Okay, welcome back to Townhouse 114 and Confessions of a New York Plastic Surgeon. The topic for this week is the treatment of dark circles under the eye or just looking tired. It's a really common problem. And people don't know, do I need to go in to see the plastic surgeon to get a lower eyelid lift or what? I mean, a lot of people just don't know what it is. And sometimes they come in here and they want surgery, and I actually recommend filling because hollows make you look very tired and older. And the problem is you catch the shadow from overhead light, and so it's impossible to cover it up with any concealer because it's that shadow from overhead light that really does you in. So one of my favorite things to do, if I've decided that they're really not a candidate for surgery, they don't have extra skin, they don't have extra muscle, they really don't have the fat bulge and extra fat that's coming out, they may just need a little bit of filling right in this area because your cheekbone is, you can touch it right there, and then you can just have it drop off to the hollow right underneath where your eyeball is actually sitting. So one of my favorite things is using this product called Juvederm. If you remember from an earlier segment, we talked about filling. Refilling is one of the 4 R's to refreshing. So in refilling, we use a filler. Typically, I may do one here, but this is another place I do it a lot. So why don't we look at some pictures just so I can kind of train your eye to what this problem is, and then you can see if you have it yourself. Okay, so this is a very subtle problem, but I hope that you can see there's just this dent here, for lack of a better word. And then this is after the filling. And she has a nice continuous line from the cheek to the lower eyelid. And you can really see that even better on her lateral view here, where this is a real dent from the cheek dent to the lower eyelid, and afterwards it's just nice and clean. This not only makes you look more rested, it also makes you look younger. Another example here, I think you can really see it. This groove and then nicely filled in. I mean, I think that's 5-10 years younger. I don't know. She looked a little bit haggard in the beginning. So this is a very common problem. I do it for men. I do it for women, all ages. I've done it in girls in their 20s to women in their 70s. Another example of a picture here, before and after. Hollow, nicely filled in. Oh, and you really see it on her side. Wow. Let me show you this. I mean, this is just a deep dent there on the side. And here she just looks fresh. She looks like a really, really young model. So this is something very common. And in fact, it's so common, guess what? I had it done myself 3 years ago.